A lot of older adults that come into our center have already really acquired poor posture. They have their weight forward over their toes, so any small push from the rear is going to put them into a need to do a compensatory step to regain their balance. So a lot of our early work, as soon as they come into the center, is getting them back into a good postural alignment. And that happens for a variety of different reasons. Some may have been using traditional walkers or assisted devices that were never appropriately fit for them, or they've been using them inappropriately for so long that now they've really developed some rather semi-permanent changes in their postural alignment that do take a lot of effort to bring back to within what I would call a normal range. If one's in a poor posture for long enough, it will be structurally changed. But oftentimes we have an opportunity by really stretching out the flexor muscles and building the strength in the extensor muscles, the anti-gravity muscles, to really significantly improve their postural alignment. And simply getting them to use visual cues can be very powerful for bringing them up into a fully centered position. Our goal is to have them centered over their feet, not forward of their base, not behind their base, so that they're in the best possible position to be stable when they're upright and when they're ambulating.
Can the Dashaway help seniors who are just attempting to regain their mobility?
I think the Dashaway could be an excellent tool for really assisting an older adult find a better postural alignment. I think a lot of the work that we do in our center is geared around bringing the client back into a more biomechanically correct alignment. So we're doing all of this good work in our center, but how nice if they would walk out of the center on a device that's going to continue to reinforce all of the really good work that we've been doing in the center. I know that doesn't happen using a traditional device. I feel that it would be much more likely to happen with a tool like the Dashaway, simply because of the postural alignment that it places the individual in, simply to move the device, and also the whole opening up of the chest, which is certainly going to improve diaphragmatic breathing and is really going to be, again, reinforcing all the good things that we've been doing in the sessions in which we've been working with the older adults.
Do you think the Dashaway's advantages justify its higher price tag?
Certainly the higher cost of the Dashaway can be a problem, particularly for older adults who are on fixed incomes. And I think that's a difficult decision that people have to make about making choices. But in my view, if you're spending money wisely, which I think you would be doing in this case, you're not only getting a device that's going to be allowing you to do much more in your daily life than you could before, also using it as an in-home gym is going to be a very valuable addition if we think about how much money we spend on that in-home treadmill or that in-home bicycle, and then we add that to our assistive device or we add it to other things. From my mind, if it were my mother or my father, there is no question in my mind that I would be strongly advocating and recommending that they purchase a device of this quality as opposed to a much lower end device that may or may not really assist them in improving their posture, may or may not really assist them in improving their locomotion. What's the price of independence? It's a very easy sell for me, but I can certainly appreciate that it is a much more difficult proposition for some individuals.
Can a healthy diet and regular exercise really help us age well and avoid health problems?
There are some pretty simple ingredients for aging well, and certainly a strong aspect of that is physical activity. Definitely nutrition is important. It does, to a certain extent, help to have good genes, but there is so much that we can do in our daily lives to really put us on the high end of successful aging and healthy aging that I believe the genes really don't factor in as much as what we put in our mouths and when we put our exercise shoes on and walk out the door.
And do you see other applications for the Dashaway in professional settings besides your own?
I think beyond the setting that I work in, certainly I work predominantly with community residing older adults. I could potentially see this device being used in hospitals to more safely ambulate patients that are just recovering from surgery, acute care wards. I certainly see it as having a lot of utility in assisted living, nursing home settings. And I could also see it as being a phenomenal tool for physical therapists to use in their practice in terms of working with their older adult clients in a much more functional setting, as opposed to using the parallel bars to do locomotion. How nice it would be for them to use a device that is more akin to what an older adult is going to be using when they leave the physical therapy setting. So I think the possibilities are endless for this device.